Okay, so this is a medical patient assessment. The first step in this skill is to put on proper PPE, which is gloves. I will now begin my scene size up. The first step is making sure that my scene is safe, which it is. I will now determine the nature of illness, which I have been told is a headache. I will now determine the number of patients I have. I only have one patient, and I will not be requesting additional EMS help, and I will not consider C-spine because of the way the patient is sitting and the nature of illness. I will now begin my primary assessment. The first step is the general impression. So I have a 20-year-old female sitting normally with no difficulty breathing. Everything seems normal. The color of the skin just with a headache. There seems to be no apparent life threats, and now I will ask for the chain cuff light. Hello, ma'am. My name is Dina, and I'm going to be your EMT today. How are you doing?
Very good.
And why did you call EMS today?
I have a really bad headache.
Okay, so as we can see here, the chief complaint is the headache. I will now begin my ABCs. So because she was talking, that tells me that her airway is patent and open and clear. And now I will assess the breathing. So I will check the pulse and breathing at the same time. So I have a pulse of 98 and beats per minute, 98 beats per minute, and respiration of 18 breaths per minute. And as I can see, there's a rise and fall of the chest. It's adequate. And I will move on to the circulation. So there is no major bleeding. The pulse was 98 beats per minute, and her skin is warm, dry, and pink. She's non-diaphoretic, and she does not need oxygen because there are no signs of shock or difficulty breathing. I will now take the history. So first, I will take the current history. So, hello, ma'am. When did this pain start?
30 minutes ago?
Okay, and does anything make it feel better?
No.
Okay, and can you describe it for me?
It's like someone stabbing my head.
Okay, and does it spread anywhere else?
No.
Okay. And from a scale of 1 to 10, 1 being no pain at all, and 10 being the worst pain you've ever felt in your life, where would you rate this?
A 7.
A 7? Okay. And how long have you had this pain?
30 minutes.
Okay. I will now take the patient's past medical history. So, are you allergic to anything?
No.
Are you taking any medications?
No.
Do you have any relevant medical history?
I had depression when I was a teenager.
Okay. And what was your last oral intake? Or what was your last meal?
Pizza.
Pizza, okay. I would ask the patient their, if a female, their last menstrual cycle. And what were you doing when this pain started?
Watching Netflix.
I will now move on to my secondary assessment. So this is focused on the neurological system. So I will assess the head. So I'm going to assess for any deformities, any hematomas, anything unusual, skull fractures. There seems to be nothing. I will, with my pen light, I would look into the eyes to make sure my pupils are normal. So my pupils are equal and reactive to light. I will look in the mouth and nose, any blood, any cerebrospinal fluid, and everything seems normal here. I will also see if the patient has a normal mental status. Do you know what time it is?
6 p.m.
Okay. And do you know what the date is? Today is?
Sunday.
Okay. And do you know where you are?
At home.
Okay. Now everything seems fine with my assessment. I will now take the vital signs. So I will take the blood pressure, which is 116/82. And the pulse, I've already taken the pulse and the respiration, pulse of 98 beats per minute and respirations of 18 breaths per minute. I will now, I will not intervene with anything, not give any medication or any oxygen because the patient does not need it. I don't really have, although it's not my job to diagnose, I don't really have a clear idea of what's going on. There's just pain in the head. This is a critical patient. I will immediately transport and reassess every 5 minutes. I will recheck the pulse, the mental status, redo my secondary and primary assessments, and I will give an EMS report. So I would say we have a 20-year-old female complaining of a headache with no allergies, no medications. She has a relevant past medical history of having depression when she was a teenager. Her assessment shows no significant findings, and the patient has a blood pressure of 118/92. The patient has a pulse of 98 and respirations of 18 breaths per minute, and I would also say our expected arrival time, and that's it.